Eileen Fuchs, and I'm a retired psychologist. I was director of counseling services at Lawrence University for many years, and through that work I got involved in a lot of the community efforts to address mental health needs.
My name is Debbie Peters, and I am the Executive Director for Community for Hope, and we serve Winnebago County. Community for Hope is a nonprofit organization. We were formed to set a mission of suicide prevention, intervention, and grief support.
I'm Chris Wardlow. I'm a prevention specialist with Catalpa Health, and I'm contracted to Outagamie County to help coordinate the county's prevention efforts around substance abuse and mental health. Catalpa Health, as you know, is I think a significant achievement, in terms of collaboration and partnerships, and really addressing the need of children and adolescents. They have also been very successful in bringing down the wait time for young people that need help. Wait time can be several weeks, several months due to a lack of providers. Catalpa has really worked to bring that down to, a number of days before a young person gets help. So,
because of us at Lawrence getting a federal grant for campus suicide prevention from the Substance Abuse and Mental Health Services Administration, we tried to share the resources we got through that grant with the other colleges in the area and with the community. And that happened to be occurring. It started in 2009 that we had our grant, and that dovetailed with a real concerted effort in the community to try to address unmet mental health needs. Up in the Fox Cities, the Community Health Action Team, CHAT, which is a philanthropic group, takes a group of leaders from the community and puts them on a school bus and drives them all over town so that they can talk with citizens who describe challenges and needs that they have. The people who experienced that plunge were so affected by those unmet needs that and they came together as a group to form something called the Northeast Wisconsin Mental Health Connection.
We've got several. This is a great area to be in terms of mental health, because we've got a lot of different stakeholders that have come together to rally their support to not only promote mental health, but also to better serve those that have mental health challenges. So there are initiatives happening. I work primarily with schools and school districts, and just about all of our school districts have worked to bring mental health services within the school site to reduce that barrier for kids and families.
Well, one of our biggest items on our mission list is to offer QPR training, gatekeeper training, and what that is it's a 90-minute session. We offer that for free. It was started out by the QPR Institute, and it stands for Question, Persuade, and Refer. So the Q, we teach people how to ask that tough question, are you thinking of suicide? P, persuade them to get help. And R is for refer. Where do we refer them to get the proper mental health care that they deserve and that they need?
And there's a children's mental health initiative that's looking at education.
And a lot of our schools are screening their students now. Either all students in a particular grade or a certain demographic of students, to identify those kids that might need some additional help. Schools are also doing a lot of work around prevention and promotion of mental health. A lot of the efforts around bullying, cyber safety, initiatives around creating caring school climate, all of those types of initiatives, in addition to suicide prevention, all have been instituted, implemented within the last 6, 7 years. We have a lot of support programming in place, thanks to organizations like NAMI that do a lot of support actually for families and individuals who are experiencing mental illness, but also they're very involved in educating the broader community and students around mental illness to really try to break down stigma. So we're very fortunate to have NAMI. We have several organizations that are doing a lot of work around suicide prevention. We also have Center for Suicide Awareness in Kaukauna that reaches statewide, that provides various support groups for survivors of suicide. They also manage what's called a Hope Line, which is a text line for young people who just need to talk, closely aligned with this initiative through Upland Area School District, but offering what's called Youth Mental Health First Aid, which is a 8-hour training that's provided to adults that want to learn more about how they can identify and support young people that might be experiencing distress or some kind of mental health crisis. So we're making progress. I think the biggest issues that we continue to face is insurance coverage. Is still not really where it needs to be. We've got a shortage of psychiatrists in our mental health system. We're also constantly struggling with the stigma issue. We really are working hard, thanks to the leadership of organizations like NAMI, to reduce those barriers, stigma barriers that discourage us from having conversations about mental health, by allowing us to talk about mental health like we would talk about any physical disease.
So it's been very much of a community effort, and it's been very gratifying because it brings a lot of people with a lot of expertise and passion together.